Hi everyone, I'm Wahinya Doc. In this video, we are going to discuss female orgasm part 2. We are going to focus on anorgasmia. We are also going to discuss on the 4 types of anorgasmia. I'm also going to explain all the causes of anorgasmia or female orgasmic disorder. If you want to understand this video better, watch part 1 of this video. I've discussed what is female orgasm, how female orgasms occur, what is a G-spot, how clitoris stimulation leads to orgasm. If you like this video and benefit from it, hit the like button, comment below, share, and most importantly, subscribe. You can search Wahinya Doc in all the social media platforms. What is anorgasmia? Also known as female orgasmic disorder. Anorgasmia is a difficulty in achieving an orgasm or experiencing a weak orgasm or failure to achieve an orgasm. What are the 4 types of anorgasmia? 1, we have lifelong anorgasmia. This means that you have never achieved an orgasm. 2, we have acquired anorgasmia. It means you used to acquire or get an orgasm, but later you are not able to experience or you have difficulty in achieving an orgasm. 3, we have situational anorgasmia. Situational anorgasmia is where we have a female who have orgasms in certain situations. Certain situations means when a female changes a partner, or when a female changes a sexual position, or when there is a change in sexual stimulation. Maybe you have opted for oral sex. That one is where we are saying there are changes. Number 4, we have generalized anorgasmia. Generalized anorgasmia is where a female has not achieved any orgasm even after changing the partner, changing the sexual positions, or changing the stimulation. It's good to mention that women who have anorgasmia or female orgasmic disorder, they have normal sexual desire, that is, they have normal libido, and also they have normal arousal. The only problem is achieving an orgasm. What are the causes of anorgasmia, or also known as female orgasmic disorder? Female orgasms is a complex interaction among physical, psychological, sociocultural, and relationship factors. All these factors can affect female orgasm. Let's start by discussing physical factors. Physical factors, we have medical conditions. All medical conditions or illnesses can affect female orgasm, but there are other conditions that specifically can result to lifelong anorgasmia. These conditions are conditions that affect the nerves that innervate the pelvis and the genital area, and also the conditions that affect blood vessels and blood flow to the pelvic region. These conditions we have diabetes neuropathy. Diabetes neuropathy is a complication of diabetes. It usually affects all the nerves in your body. When nerves are damaged by diabetes, they are not able to sense well. So this one can cause you to have anorgasmia or difficulty in achieving an orgasm. Number two, we have high blood pressure or hypertension. Hypertension can damage the blood vessels that supply blood to the pelvic region and your genital area. This will result to low blood in that area, has less sensitivity to stimulation. We have another condition we call multiple sclerosis. Multiple sclerosis is an autoimmune disorder. Autoimmune disorder means that your white blood cells produce antibodies. Those antibodies attack your nerves. So multiple sclerosis will damage your nerves that innervate your pelvic region and the spinal cord, resulting to difficulty in achieving an orgasm. We also have other injuries of the spinal cord. Maybe someone got an accident and had a damage with the spinal cord. Now, B, we have medications. These are class of medications that can affect your orgasm. These medications include drugs that treat high blood pressure, and not all the drugs that affect female orgasm. We have beta blockers. Beta blockers are used to treat hypertension. Then we have anticonvulsant. Anticonvulsants are drugs that are used to treat epilepsy. Other drugs of that class are used to treat the nerves. Those drugs also affect female orgasm. We have antidepressants. Antidepressants are drugs that are used to treat depression. These usually have result to experiencing awake orgasm or difficulty in achieving an orgasm. We also have type 2 antihistamines. Type 2 antihistamines are drugs that inhibit the secretion of hydrochloric acid in your stomach. These include cimetidine. C, we have drug abuse. If you are taking excessive alcohol usually damage or depresses the nervous system, hence result to less sensitivity to stimulation. Also, we have smoking. Smoking results to blockages of blood vessels, all the blood vessels, including the blood vessels that supply your pelvic region. We also have narcotics like cocaine, heroin, etc. Number 4 or D, we have gynecological issues. These are surgeries, gynecological surgeries. If maybe a female has a surgery where uterus was removed, or the part of the ovary was removed, or maybe a female patient had a cancer of the uterus or of the cervix, and it was part of the female reproductive system was removed. This one can affect female orgasm. We also have the aging process. Aging process, as you grow old as a female, there are changes that occur in your body. These changes include hormonal level changes and circulatory function, among other changes. Examples of changes in women is the low levels of estrogen. Low levels of estrogens happen when a woman is transitioning to menopause. When a woman has low levels of estrogens, there are certain things that happen. One, the wall of the vagina become thin. Number two, you have a problem with the lubrication because the secretion of the vaginal fluid is reduced. Hence, you have a dry vagina. Dry vagina result to pain during sex. Number three, you can get less sensitivity to your clitoris. This is because we have a thinning of the labia majora. Labia majora usually covers the clitoris. After menopause, a thin labia majora exposes the clitoris. When a clitoris is exposed, it will reduce in sensitivity to stimulation. All this will result to painful sexual intercourse and reduce sensitivity. Then you cannot get a female orgasm, or you might experience difficulty in achieving a female orgasm. Number two, I've said we have physical causes. Let's go now to psychological causes of anorgasmia. Psychological causes include depression. Depression is a mood disorder where you have a persistent feeling of sadness and you will become uninterested in everything. This includes sex and orgasm. There is anxiety. Anxiety is a feeling where you feel tensed and also anxious. In that situation, it is difficult to achieve an orgasm. C, we have fear of getting pregnant and contracting sexually transmitted infection. Maybe you have your own reasons why you don't want to conceive, and also maybe you have noticed your partner has these funny rashes around his body, and back in your mind you are thinking this must be HIV. That one will affect orgasm. D, in case you have stresses and financial problems, this will result to not focusing when you are engaging in a sexual activity, and will result to an orgasm. So relax, mommy, and enjoy the natural act. Then we have embarrassment. Embarrassment is a psychological issue. There are some females who are so embarrassed to an extent that they will switch off the lights, or maybe they will prefer to cover their whole body when engaging in a sexual activity. This one will affect female orgasm, or you will experience that difficulty in achieving an orgasm. Then we have a poor body image. Poor body image is a mental illness where you focus on a problem in your body appearance or a flaw in your appearance. This one keeps you thinking for hours, days, even up to 2 years. So this one can impact your life because you cannot be able to function normally. It can also affect your sexual life. These are women, sometimes you find they are having excessive makeup, or maybe they are exercising too much because they are always thinking they have a certain problem. Then we have we have socio-cultural and religion issues. If a female is too religious, they might not be able to enjoy sex, and also some cultures do not allow premarital sex. So this one can result to a failure in achieving an orgasm. And lastly, in psychological causes, we have sexual abuse and emotional abuse. Sexual abuse means maybe you have a history of rape. Rape usually affect females and affect orgasm. Emotional abuse means three things. There's a verbal abuse. Verbal abuse is why your partner is insulting you. Then we have rejection. Rejection is where your partner always rejects your ideas, your thoughts, your opinions. C, we have gaslighting. Gaslighting is a type of emotional abuse where your partner make you feel that your ideas, your opinions, your feeling, your sanity is wrong. They do this by manipulating you. What are the Number three, what are the relationship factors that can lead to difficulty in achieving orgasm? We have poor communication with your partner. So, as a female, try to be open and honest and tell your partner about your likes, your dislikes. Tell them how you feel to be stimulated. This one will help you achieve an orgasm. Then B, we have different level of desires to sex. Maybe your partner is not much interested in sex than you, so even their performance can affect you to not achieve an orgasm. Then we have other relationship factors. We have breach of trust or cheating. We have issues that maybe you have not solved. You have unresolved issues with your partner, and also you have a lack of connection with your partner. All these physical factors, psychological causes, and relationship factors can affect how you behave sexually. They can result to difficulty in achieving an orgasm. They can make you experience a weak orgasm or have a failure in achieving an orgasm. Follow and subscribe for the treatment of female orgasms. We have so much when it comes to treatment. I'm Wahinya Doc. Thank you in advance.